Yes, we have the privilege of working with Dr. Buie, who's gotten very involved with the operations, and can hand over to Dr. Buie to talk about transportation and food management and several other topics. Dr. Buie, appreciate you being here to share with the board.
Thank you. Good afternoon, Madam Chair, board members, Dr. Grimacy. That's a perfect lead in. We're talking about moving on and getting up and moving. So we'll start off talking about transportation. The Transportation Department will have an increased health and safety regulations to ensure that all students and staff are safe while being transported by bus. Drivers and students are required to wear a face covering. Drivers will have face coverings available for any student who does not have one. Parent guardians must provide statement of attestation for students to board the bus. Statement form will be sent to the residents of all students signed up for bus transportation before the first day of school, so they'll have them available the first day of school, first morning pickup. For physical distancing, there will be one student per bus seat, although two students from the same house may share a seat, but no more than two per seat at any time. All buses, they'll be supplied with hand sanitizer and tissue boxes. And there's a system and process in place for all buses to be disinfected between routes. And that could be, between schools or at the end of the day. So there's a lot of information on that slide. So if you have questions, please feel free to ask.
Dr. Buie, this is Helena. If a child does not board the bus with a statement of attestation and the parents have already left for work, what are the options?
Generally, we're still working through that, but right now I think we treat it similar to when a student that may miss a bus. A lot of times in the bus garage, they'll get phone calls from parents saying, my kid missed the bus, can you come back, can you do that? The bus will communicate with the bus garage, who would then work to communicate with that parent to hopefully, get the kid taken care of.
So Dr. Buie, so that statement of attestation is a daily request or daily requirement?
Yes, ma'am. Yes, ma'am. Madam Chair, it is a daily request that the child must possess upon entering the bus.
Right. I anticipate that being a difficult thing for some of our families.
Yeah.
Do you know? Oh, go ahead.
It's John Weaver. The statement of attestation, is that something that will be collected, or is that something that the student can retain?
That's a good question, Mr. Weaver. Yeah, the driver will collect the attestation as the child boards the bus. The child then, when the bus arrives at school, they'll still be required to have symptoms checked, including temperature, upon arrival. But the intent of the attestation form would be to speed the process up as far as pickup goes, but they would still need to have their temperature checked and go through the symptom protocol when they reach the school.
Thank you.
Yes, sir.
Do you have the results yet of the transportation survey?
By survey, I'm assuming you mean the folks that are...
The request form.
Yeah. Right now, we're at about 3,500 kids that have registered for transportation. Yes, ma'am.
And how does that compare with ridership last year?
Dr. Grimacy, last year we were over 5,000, around 5,300 kids when, I'll say last year, but last school year when we closed.
And if an individual does not fill out an application, do they still ride the bus?
Right now, the Transportation Department, they're working on two spreadsheets. One's a list from last year of all the kids that rode a bus. One is a list from this year of those that have registered. We're going to get those kids that haven't registered identified and cooperate with the schools and try to reach out to those folks to work with them as far as transportation is concerned.
And so what happens if I have not registered and I want my child to ride the bus?
If you haven't registered and want your child to ride the bus, we'll do everything we can to get the child on, but it may be a few days before we're able to get the child on the bus just because of the way the routes have to be designed ahead of time so drivers will know where the stops are and the times for pickup.
So if on a given day where a child shows up at a school bus and they have not registered, will we transport them to school?
Absolutely. We'll never leave the child beside the road. Yes.
Okay, what follow-up will then happen with the parent that hasn't registered to clarify to them that they need to register?
The school would contact the transportation department, who would then communicate with the parent and registering the child for transportation services.
So the intention is that we have everyone register who's going to ride the bus, and why is that important?
Well, it's important for a variety of reasons. First and foremost, so we know who is on the bus, obviously, and then secondly, so we have accurate stops and that we can make timely stops, and that it's a safe environment for kids because they're all accounted for on the buses.
And is it our goal to try to, in past years, we're always trying to increase ridership and encourage parents to have their children ride the bus. Are we taking a different approach to marketing that this year?
Good question. Absolutely. We did include in the registration form that if, we would recommend parents transporting their children to school in light of the circumstances we're all under now. Yes, sir.
And in those circumstances, how does it benefit everyone if I am able to take my child, if I'm able to transport my child each day, how does that benefit everyone?
Well, it allows there to be fewer children on the bus, which in turn allows the bus routes to be shorter for everyone involved. Less symptomatic checking would be involved. The attestation process wouldn't be as lengthy if we had fewer children riding the bus. There'd be several reasons for that.
Okay, thank you.
Thank you.
Dr. Bowie,
Yes, ma'am.
I think there's been some discussion, and not necessarily in Moore County, but in other systems throughout the state, about having bus drivers or bus monitors to check temperature as students actually get onto the bus. Now, I realize that is another responsibility we'd be trying to put off on our already scarce bus drivers, but is that something that's been considered?
Mr. Barath and I, we talked about that. We just feel we simply would struggle with the staffing when it comes to that. And also just in talking to the transportation experts here in Moore County Schools, who I have a lot of confidence in, they just feel like if there's a bus traveling down US 1 or if there's a bus on 15501, that if that bus has to stop and pick up, more than one kid, if it's a multiple kid stop, 2 kids, 3 kids, by the time that kid would climb the stairs, get the temperature checked, they just feel like it would be a safety concern on several fronts. Primarily, it's challenging. It'd be a challenge, I think, for the driver, Madam Chair, to really be focusing on what's going on around them. If they're focusing on temperature, possibly recording the temperature. So those were all factors and just not, going that route and instead just requiring the attestation.
Mr. Bowie, Dr. Bowie, this is Betty Brown. Since we're having fewer students, and you may not have this answer, so you can get it for me for the August meeting. How will this affect our budget and our use of school buses? And will we have the same number of buses being used? Will we have the same number of routes?
That's a good question, Dr. Brown. A lot of that we would have to look at and possibly get back in the August meeting.
That would be fine.
Yes, ma'am. Okay.
Thank you.
Board members, I hope you can appreciate the complexity of the transportation requirement. There have been a number of those long lists of questions that we've gotten from some people with 10 or 15 questions on them, that there's always, well, what are you going to do? How are you going to do this? How are you going to do that? We share those questions. Another advantage to approving Plan B today is that you provide that framework for planning. Once Dr. Bowie and Mr. Barath and Julius and the team all know what the framework is, now they're going to be better able to address those details. But it is important to us, if there are families that can transport their children this year, during this time, we hope they can do that. We anticipate that there will be some drivers who, under the circumstances, are going to choose that they simply can't continue to drive with the environment that they'll be in, even with just one child on each seat. So our usual bus driver shortage is we have to be candid about that up front. It's a challenge. It's a challenge to manage one child on each bus when normally we're being held accountable by the state to maximize student ridership per bus. And Dr. Brown raises a very important point, which frankly was left as a loose end by the General Assembly. And I thank you for bringing that up, Dr. Brown. We do not have limited resources here, and this superintendent is not in a position to be very grateful to the federal, state, or local level with regards to resources that make this planning easy. They make it possible, but nobody has gone overboard in being overly generous with what we do. We have some real restrictions that we have to work under. We were not given a blank check, and transportation and child nutrition are two of those areas where there are some significant challenges. So let's go ahead and keep transportation on the list for your August 3rd work session. I would anticipate that Mr. Dockery and Dr. Buie and Mr. Barath are going to have a lot more details for you by the time we get back on August 3rd. So Dale, thank you very much. Madam Chairman, can we move on?
I have a question.
Yes, Mr. Wood.
A statement, really. I don't know whether it should have been directed to Mr. Hewitt or not, but I assume that social distancing will be required on activity buses as well. Is that
the social distancing requirement on buses actually was modified in one of the revised sets of guidelines? If you'll recall, throughout this summer, guidelines by DHHS have been revised about every 2 weeks. So again, for individuals that have had a hard time understanding why we haven't really disclosed a lot of our plans is because frankly, the rules were changing sometimes within 8 to 10 working days. And so the minute you would make an affirmative statement about what you're going to do, you had to change it. And so there's enough confusion going on. We didn't need to make that worse by continuing to put out refinements of the plan as the summer went along. But it's one child per bus, and that would include activity buses. Mr. Buie, correct me if I'm, or Mr. Barath, correct, Dr. Buie or Mr. Barath, correct me if I'm wrong on that. With family group, with exceptions for family groups, if they're siblings, they can sit on the same seat. But
Yeah, you're correct, Dr. Griffin.
One child per seat.
One child per seat. That means they'll be within 6 feet of each other, so we can get more children on the bus than if they had spread out. You remember, I think at one point I noted that if we had to respect 6 feet of social distancing in our buses, we would have needed 300 more buses to transport all of our riders from last year. Well, that's the reason for now this rather odd request that we ask parents if they can to transport their own children. Because even if you reduce that to one child per seat, we don't have nearly enough buses and drivers to transport everybody who rides to school every day without some serious modifications on arrival times of buses.
I think Mr. Weaver's question might also pertain to athletic transportation.
Oh, absolutely. Same rules.
But that's a moot point at this time.
Yeah, same rules would apply when we I hope we get to that point, in the near future where we're transporting teams, but we would have to look at options because, as you all know, there's not a lot of investment in activity buses, and we keep our activity buses rolling because our mechanics are dedicated and our schools do a very good job of keeping them rolling, but there isn't a lot of discretionary money in Moore County schools. And so, we would have to find out, we would have to get a supplemental for like a track team. We either have to limit the number of students that can go to away competitions or find other buses and find ways of covering that cost. Dr. Buie, interfere here if I'm speaking out of turn.
No, sir, you're right on spot, Dr.
Okay. Anything else on transportation? As you can see, this will be one that we'll be offering an update on August 3rd.
Thank you. Thank you, Dr. Buie.
Yes, ma'am. With your approval, Madam Chair, I'll continue into the sanitation and cleaning.
Go right ahead.
Okay. As we return to school, schools are completing the cleaning and disinfection of the facilities to be ready for staff and students. Cleaning and disinfecting at a heightened level will take place daily, and I'll emphasize heightened level. Schools will follow NCDHHS environmental health section guidance for cleaning and disinfection, including using a schedule with custodians to perform ongoing and routine cleaning and disinfection of high-touch surfaces such as door handles, stairs, rails, toilet and faucet handles, toilet rooms, drinking fountains, light switches, desks, tables, chairs, countertops, keyboards, phones. It's a long list, but those are all areas that kids will be all over. Just in just in my years as principal, walking down the hall, there's always 2-3 kids at a water fountain. So those just being cognizant and aware of the high touch areas and making sure they're taken care of daily, and in some cases multiple times daily. Custodians, they'll routinely check and refill, replace hand sanitizer, soap, and paper towels. Also, maintenance technicians are disinfecting all mechanical airways and flushing all water lines. This absolutely would include the changing of the air filters to make sure the air students are breathing and the water they're drinking is as clean and pure as possible. Just moving on. I want to emphasize this because I've had a few questions. Teachers, they will be provided with cleaning and disinfecting products they will need. These will include spray bottles of disinfectants for each classroom, paper towels, gloves. Also, application instructions will be provided to teachers. Custodians, they'll make sure that the products are available and provided to them at all times in a timely manner. And then just as far as the day-to-day goes, teachers, they'll disinfect shared objects between use. And I think with the shared objects, teachers, they'll be aware to limit these as possible. Sometimes you can't, but sometimes they will. But this would include physical education equipment, as Mr. Hewitt touched on earlier with how things are going to look different. PE classes will look a little different as well, but art supplies, CTE equipment, toys, games. And when a teacher disinfects, this will be done without students in the classroom. Maybe they would be, between classes, outside, et cetera, but that it would be done when they're not in the classroom. In the case where, as all educators will tell you, there's going to be kids that during normal times, they're going to get sick in the classroom. If this were to happen, teachers will know that they can call a custodian just like they normally would for areas that would require immediate attention. But again, these will be the things that are provided to teachers, and we'll continue to work with building principals for their individual operational needs to take care of them as far as supplies go or things they need. Continuing, as we move through and talk about the sanitation and the PPEs, all students, staff, and others, they must have a face covering, have their temperatures taken, and symptom monitoring questions responded to before entering the school. Thermometers will be provided to all schools, multiple touchless thermometers to help expedite the process. Each school operationally, it'll probably look a little bit different, but there will be identified control locations at each campus for students to have temperatures taken and for symptom monitoring questions to be asked. All school entry points will be secured, and main entry location will have signage displayed. Schools will have disposable face coverings to provide to anyone who arrives on campus without one. Face coverings must be properly worn at all times. Another piece that we focused on and worked to make sure things are ready for the beginning of school was the signage. Signs will be posted throughout the school, designating physical distancing, face covering requirements, the 3 Ws, as well as the reinforcement of proper hand washing. There's a lot of different signage that's been ordered, including, the vinyl type signs that a school or a principal would want to put on the carpet in the office, because, if you put a hard tape or a duct tape like thing down, when you tear it up, it's going to leave a mark. So a lot of the folks and as a principal, I know, or as a former principal, we're protective of our carpet. because it doesn't come around as often as we'd like. So that's something I've heard. But nevertheless, a lot of the signage is ordered. Some of us arriving, it will be delivered to schools for them to use. And then continuing with protocols in the buildings, hallways, they'll have directional signs and markers. These are also signs that have been ordered for schools. Classrooms without sinks will have hand sanitizer provided. Each school will have an identified space for students who display symptoms. This will also be notified by signage. And at the minimum, 5 reusable face coverings will be provided for each student, each teacher, and each employee. But operationally, we'll be able to assist schools with their needs as far as additional masks, whether they be cloth or whether they be disposable type masks. So I'll pause there because I know that was a lot of information.
If I might add, Dr. Buie, if I could just add to that, board members, the statement I made earlier about me feeling as though there were some areas where we didn't get the resources that we need. Dr. Buie, I think you'd agree with me that there's been an extraordinary amount of funding that we have this year for things like hand sanitizers and face masks and PPE, the variety of things that we've seen from teachers who've in their comments and in the emails that we get. They're worried that it's going to be another one of those situations where they get that certain amount of paper at the beginning of the year and then it runs out. I don't think it's going to run out this year. Not only have we gotten the funding, but also some of the early concerns we had about supply chain have not played out, that actually the markets have responded. And as we've moved farther in the summer, the availability of these products has really increased. So Dale, correct me if I'm wrong on that, but that's certainly been my perception in the conversations I've had with them.
No, you're absolutely right. When the closure started, we were really concerned, like you said, that the supply will be an issue. So we worked really hard to stay in front of the PPE supplies, the disinfecting supplies. So yeah, we're in a good place, and I agree with you. I've seen things where people are kind of concerned that it would be like where you get one ream of paper and after that you're on your own. It's not going to be like that. I mean, there's a lot of almost wish I had a picture of the warehouse. We have a lot of things, and just the availability of the supplies is there, so we could refresh it quickly if we needed to. Yes.
And that includes clear face shields. I've been very impressed that we're moving in that direction, as I understand it, certainly with our speech pathologists and our audiologists, where the ability to see children's and the teachers' facial expressions, and then also our youngest children. Talk just a little bit about clear face shields and
sure, absolutely. With the word unprecedented gets said a lot, but it makes you think about a lot of things that you don't normally think of. As a former principal, there's been multiple hundreds of times where I've sat in on speech therapy or other types specialized instruction. Never ever would it occur to me the importance, and it should have, of reading the child's lips. But in conversation with Dr. Bullard early on, I mean, this was this is probably May. We talked about the need for the masks that have the visible mouth for children, the need for the shields, just so it's important for all kids, but especially for exceptional kids to be able to gauge and understand and read expressions, especially in therapy sessions. So yeah, Dr. Grimsey, there were a lot of discovery aha type moments in going through and making sure we had the supplies that all students needed. Yes, sir.
So our kindergartners, pre-K students, and first grade students, many if not all, will be able to see their teacher smile. And
many will, and then even our elementary kids, our younger elementary kids, we've been able to find child-sized masks. So hopefully that will help with them, gaining familiarity with wearing one in a public setting. So yes, sir.
Dr. Buie, this is Ed. I have a suggestion that I thought about, particularly for pre-K, kindergarten, and first grade. I don't know how you do it or what, but I was thinking about if their mask had cartoons or facial expressions or something on there, just so it wouldn't be so stressful for these kids coming to school the first time to see all these people walking around with masks on. And no, you don't have to make any comment, but I don't even know if they exist or not. But I think it might help.
Thank you.
Quick, this is Dr. Brown. Question. As you talk about sanitation, on the Wednesdays that the schools are being sanitized, is this going to be during the day when the teachers are going to be there, or is this going to be after the time after teachers leave? What's the protocol?
Well, and as you know, stated earlier, all disinfection is going to take an enhanced nature daily. The Wednesday where students aren't there to allow custodians, staff to be able to disinfect some areas that may be populated more heavily with students during the week, so they can give it more special attention. Not that it's not going to be disinfected daily, but it'll just give them an opportunity to hit areas that may be a little more challenging to hit when the school is full of students and staff.
Okay, thank you. I just want to make sure that our teachers aren't in the way as they're doing this, and that the sanitation people aren't in their way as they're trying to meet and collaborate and do online instruction and professional development for that too.
Yes, ma'am.
Dr. Bowie, off of
Yep,
that, what about Saturday disinfection then? If we're going to be cleaning a little more thoroughly after the Monday, Tuesday group, then what about cleaning after that Thursday, Friday group is in there to prepare for Monday? Will we have custodians reassigned to Saturday duties?
You know, Madam Chair, I think if once we start back, I think if we determine that would be a need, that would be something we could entertain. But I really feel like, you know, custodial staff and then the discussions with maintenance, they really feel like that they would be able to sufficiently disinfect the Friday afternoon as the building empties of students and staff to have it ready for Monday morning.
Well, that sounds good. I can tell you for Sylvia, who works on the second floor at Pinecrest, you could eat off her floors all the time. So they do a good job.
Great.
Dr. Buie, can you talk a little bit about these isolation spaces for students? Not all of our schools have dedicated nurses. So just wondering about what those procedures look like when we have a nurse and then when we don't have a nurse.
Yeah, the guidance in the NCDHHS document, it instructs us to set aside like a quiet area. I hate to call it an isolation because it's not going to be an isolation because there'll be a staff member with the student. If the student's symptomatic, they would go to this room. They would be escorted by a staff member to this room. You know, each school would probably have a little bit of, it would look a little different operationally possibly, but it would be a designated spot. It would be in a private, safe, secure area, and the child would be supervised at all times. If it was a situation where a child had, you know, a high temperature when they checked in, they would go to this particular waiting area. When they arrived there, they would get their temperature taken again. If their temperature, you know, if they took it again and it was high again, then the parent would be notified that they would need to come pick up the child. But it's going to look something like that. And there'll be PPE there, equipment for staff. There'll be PPE for the child, you know, as well, additionally. So that's like I said, it's going to look a little different, maybe at different places, but that's kind of the gist of what the requirements are.
Dr. Buie, this is Pam, and just a comment, and just grateful for providing all the supplies, but especially the face shields that you mentioned for our employees, for all of the different age groups, but especially some of our little students who like to be up close and personal to our teachers, as well as with some of our therapist employees, with our EC students. That should help. It should help to mitigate it. So I'm glad to hear that they will actually have these companies.
Yes, ma'am. Thank you, Ms. Thompson. Okay, we'll move ahead and talk about our driver education program. Driver education program protocols resuming behind the wheel instruction the week of July the 27th. This will address the backlog that took place at the closure at the end of last school year. Protocols outlined by NCDPI and NCDHHS will be followed The instructor, they'll conduct daily health self-assessment and submit forms to the driver's education office, the director. All staff members, everybody in the vehicle, they'll have a face covering on at all times, and maintain physical distancing in the vehicle. Prior to entering the vehicle and between drivers, I'm sorry, my tongue is tied up on me. The instructors shall disinfect all touch surfaces such as steering wheels, door handles, seat belts, seat controls, turn signals, etc. Have everyone wash, disinfect their hands, maintain physical distancing while waiting to enter vehicles, and conduct symptom monitoring and temperature checks of students. The driver's education protocol will be in line with other protocols at school facilities. Each vehicle will be supplied with hand sanitizer, tissue box, and disinfectant for use. And then classroom instruction, the plan is for it to resume with the reopening of school. And there'll be information posted on the driver's ed website as we get closer to the return of students to school. Child nutrition, in order to ensure the health and safety of students, which is of course our #1 priority, while eating on campuses, the Child Nutrition Department has strengthened its protocols and practices. Under Plan D, pre-portioned meals and bag lunches will be consumed in the classroom. At the elementary and middle schools, food and food here is breakfast and lunch will be delivered to classrooms on carts. So it would look essentially like it says, a lot of elementary schools in the past, elementary teachers, they've done a food count. And that's let the cafeteria kind of know what to prepare in the morning. It's kind of allowed them to prevent waste. It'll look similar to that, where, when a teacher would do a food count, they would let the cafeteria know that, they needed, 22 meals. And then the cafeteria would know to prepare 22 meals and have those delivered to the classroom. So that would helps prevent movement of students, crossing paths with other students, et cetera, and follows along with the other safety protocols that'll be in place. High school students, they'll get their meals from stations and kiosks in the cafeteria and other locations at the principal's discretion. It'll look a little different, but it'll still, not be the typical congregational type seating that we're all used to seeing. So it'll be different in that sense, but still they'll be following social distancing guidelines. The meal distribution program that I'm super proud of that has distributed so many meals over the summer. It's going to be extended through at least Thursday, August the 13th. It'll be Monday through Thursday with double meals on Thursdays. The same locations and times, we'll still use those in meal distribution. Child nutrition staff, including, Ms. Lovelady, are still waiting on guidance from the state to come up with a solution to feed kids, to provide meals the 3 days they wouldn't be in school. And we hope to have more information and updates on that and more guidance by the August 3rd board meeting. I'll be happy to answer any questions if you have them.
Dr. Buie, this is Helena. Thank you for talking about the meal distribution for those off days, because I was interested in that. So I'll look forward to your report in August.
Yes,
question about the food in the classroom. One, will teachers have an option, weather dependent, of course, to potentially eat outside with their class? And two, if they are eating in the classroom, what will be the cleaning procedures after lunch, and who's going to be responsible for that?
Yeah, good question. In the previous week, I visited, a lot of our schools and had a lot of conversations with principals, and I got that question from several principals. I think this is one of those things that there'll be some operational flexibility by school, because I know as a principal, you want to make the experience as good or as positive as you can for students. I know some principals have already started thinking of ideas maybe to socially distance in the cafeteria, to be able to use open areas for kids to eat their lunches separate from others, while follow the protocols they're supposed to follow, but yet still being able to keep social distance from others. But maybe, you're right, maybe being able to soak up some fresh air. And as far as the cleaning procedures go, I mean, I'm thinking to my experience as a principal and how that would have looked with the custodial schedule. I mean, I know it would either be, the teacher could just pop the desk and wipe those down, or that could very well be, the school could have a schedule where the custodian visits that classroom after the lunch period. I know a lot of the schools I've been at before, the lunch period, as soon as kids went to lunch, then their room would be scheduled for cleaning. So I think that would kind of be a little bit different by school as well. But I think, either the teacher would squirt it and wipe it down, or the B, the custodial staff would hit it upon completion of the lunch period.
Mr. Buie, Dr. Buie, this is Betty Brown. What's going to happen with monitoring of the meals for the students for payment and for, are the teachers going to be responsible for monitoring that? Because currently cafeteria staff take numbers and put it on.
Yeah, that's a good question too, Dr. Brown. Miss Lovelady, I talked to her yesterday. She found out that at least for the first 2 weeks, the schools will be operating under the USDA, summer meal program, which is the meal waiver that we've used, that we've been able to use during the summer feeding program. That's a little bit different. Dr. Brown, it just requires that you pretty much just keep a count of meals, as opposed to a lunch number or paid or free or reduced. It's less restrictive. So Ms. Lovelady, she was positive and happy about that, because that's going to give child nutrition staff kind of a 2-week bonus period to figure out the best way to go about recording, lunch numbers and taking payment and those kind of things. But just in our discussion, we both agree that it'll kind of look like what I talked about earlier with the meal count, the head count is what we always called it in the school. As far as lunch, you do your lunch count in the morning. You would identify who's eating, and then you would kind of springboard off of that process to take care of the lunch number or the payment. But it would need to be something that happens first thing in the morning in the classroom. Yes, ma'am.
Dr. Buie, this is Pam. For the breakfast being in the classroom, does that mean teachers will have to report earlier, or will that be an issue? Because typically the students come in, they go to the cafeteria. So will there be any?
No. Good question as well, Ms. Brown. No, they wouldn't have to come in earlier. Again, the breakfast will be prepackaged, and just in talking to a couple of building principals, each have different ideas about how they would get that to the classroom. One just kind of shared an idea with me where the breakfast would be waiting when the children arrived in the classroom. So that wouldn't be a cause for extended hours for any staff.
Thank you.
Yes, ma'am. Thank you.
And I had a question about one more question about the building entry, so the temperature checks and that process. Is there an estimate about the number of staff that will be needed to help accomplish that in the morning?
I haven't seen an estimate on the number of staff. Again, I think Ms. Waller-Miller, I think it'll be different at each school. I mean, I think at the different size schools that I've worked at in the past, I think, some schools you would probably, require an entrance for car riders, a checkpoint. I should have said a checkpoint for car riders, a checkpoint for bus riders, and you'd be fine with 2. Other schools that have larger areas, you would maybe want to do more than 2. And then the staffing needs would depend on how you wanted to effectively have that done at your school. I mean, different principals I've talked to, you'd have somebody you wanted to check temperatures, possibly record temperatures. You might want to have a different individual ask the symptom questions, and so I'm thinking it would be a little bit different at every site.
I think all of us have had experience going to particularly our healthcare specialists, where all of us have to attest when we go. We have our temperature taken. We are asked the questions. It generally takes about 60 to 90 seconds. And so again, using Pinecrest as our most extreme example, if we think in terms of 1,100 students times 90 seconds each, you can see the challenge that is before the principal and the staff. And that's why we need to operationalize this as soon as we can, so they can begin to look at that and inform us if there's any resources or support that we can provide as they go through that.